All right. Yeah, hello everyone. So I hope everyone is doing well and staying safe. My name is Chris Chen, and I'm here to discuss unregistered and unidentified public water systems in Indian country. I'm a drinking water inspector for Region 9's Enforcement and Compliance Assurance Division. I also have with me today my colleague Gholson from the Water Division's Tribal Drinking Water Program on hand to assist with any questions. And I'm also giving this presentation today with the goal that hopefully afterwards you'll have a greater awareness of when residents or workers in Indian country may be drinking water that is unregulated, when the water really should be regulated, and the consumers should be protected by the Safe Drinking Water Act. In order to identify whether a drinking water system should in fact be regulated as a public water system, it's important to review what the definition of a public water system is according to the Safe Drinking Water Act. So the definition according to Safe Drinking Water Act, sometimes referred to as SDWA, it's any drinking water system that serves piped drinking water to at least 25 individuals or 15 service connections for at least 60 days per year. So there's a couple numbers thrown around here. First thing I wanted to emphasize was that it says serve piped drinking water. So you might think sometimes there's those groundwater wells and you pump the water and it just comes out of a spout from the well itself. That would not be a public water system, typically a well. And then it has pipes that's distributing water to the community. Secondly, there's two different criteria that you could meet in order to be a public water system, and that's the 25 individuals or 15 service connections. And for those who aren't aware, roughly a service connection is, a home or a building or a workplace where there's, a piping coming from the main water lines and is getting served the drinking water. And then lastly, a drinking water system should be serving water to consumers for at least 60 days. Within that broad definition of a public water system, there are three classifications for a public water system. The most common public water system type that you'll see is a community water system. And that's any public water system that serves the same people year round. So it could be, most likely you associate community water systems with cities or a town where there's many residents and they're drinking that water every day, essentially for the whole entire year. But that could also be, smaller water systems such as the mobile home parks. Might not be something that you necessarily think of off the top of your head when you think of a community water system. But if that mobile home park has the same, residential consumers for the whole year and has 25 or more people, it would still be a community water system. And a community water system has the most strict or rigorous regulations compared to the other classifications. So there's more that they need to do in order to stay in compliance. The next tier is non-transient, non-community water systems, and those are public water systems that serve the same people between 6 to 12 months instead of year-round. And you can think of, workplaces or colleges, if those are being served by a drinking water system, and that's the only thing really being served by the drinking water system, those may qualify as, non-transient, non-community water systems. And then lastly, there is the transient non-community water systems, and those are public water systems that serve different people over the course of a year. So, the rest stops when you're on a road trip or you go to a state park, there's visitors coming and going, and it's a diverse set of people drinking the water at any given time. And that has the the least amount of requirements, because you're going there and chances are you're only drinking the water a couple of times during your visit, and then you may not be drinking that water again for the rest of the year or possibly ever again. And one thing I wanted to note is, when in doubt, that you take the more stringent classification. So, for example, if there was a public school in a rural setting, you think that might be a non-transient, non-community water system if the water is being served primarily to that school only. But let's say connected to that school water system, there was 20 homes and 50 people being served, and they live there. Then that could be classified as a community water system, even though the school, say, serves 300, 400 people, and the community, and the residential population is only 50. We would take that 50 residential population when determining the classification. I wanted to share with you an example of a basic water system. Of course, you have the source. Generally, sources nationally are coming from groundwater, especially for the smaller water systems, which would traditionally be the case when it comes to unidentified water systems. But it could also be surface water. And then, of course, after you get the water from whatever source that you do have, it may go through some sort of treatment process to try to filter out any contaminants that you may have. Usually, if there isn't any sort of treatment, it would be chlorination of the water to try to control for bacterial contaminants potentially in your water. And then after treatment, the water will go either to the distribution lines or to a storage tank first. And so, after treatment, it's actually going to be served to the consumers, whether it's residents or workplace or a school or something else. And a water system should typically have some sort of storage in order to ensure that if the well were to go out, or the source weren't providing, or the demand were higher, or any other criteria, that there's some supply for the community so that water can continue to be served with no disruption. So even though it's called public water system, I wanted to emphasize that it can be owned and or operated by essentially anyone. You might think, okay, there's state agency, federal agency, or local municipality. They operate public water systems, but a public water system can even be owned and operated by a homeowners association, or even an individual could own and operate a public water system. So don't get misled by the fact that it's called public water system. That just means that it is serving water to the public, not that it has to be a publicly owned and operated water system. So share some numbers. Nationally, in the US, there's approximately 150,000 public water systems. Approximately 90% of all Americans are being served drinking water that's regulated. Of course, that also means that there's around 10% of the American communities that are not being served regulated drinking water. And if you think about the population of the US, that's on the magnitude of millions of people who are drinking water that does not have the same level of protection as a regulated drinking water system. Within Indian country, there's over 1,000 public water systems nationally, and that serves over 1 million people. There's only one tribe nationally that has primacy to implement the Safe Drinking Water Act instead of EPA. And so Navajo Nation has primacy over approximately 170 public water systems. But other than that, all other public water systems in Indian country, EPA has direct regulatory authority. And so EPA would be who you would be working with on a daily basis if you were an owner or operator for a public water system, not a state agency such as California or Arizona. So why are unidentified public water systems a concern? Well, first, if hasn't been identified and registered with EPA, then, of course, it's not being regulated by EPA or then likely any other regulatory entity to ensure that the water is safe to drink in the first place. If there is, no one overseeing these drinking water systems, it may not be necessarily being operated by anyone qualified to operate a drinking water system to help maintain the infrastructure and also collect samples to monitor to make sure that there's no contaminants that are being consumed by residents or workers or just even passersby. So yeah, no sampling, no one qualified to operate, and there's no regulatory agency such as EPA to go out and do regular site visits to identify if there are any concerns with the drinking water infrastructure or any deficiencies that need to be corrected to maximize protections for any consumers. If it hasn't been identified and regulated, there's less incentive to install the necessary measures, such as a treatment facility to eliminate contaminants in the water. And that's, of course, assuming that the owner operator is even monitoring in the first place. But let's say they were and they detected there was, arsenic or bacteria or, pesticides in the water. If they're not being regulated, they can, possibly get away without treating those contaminants, and that would leave residents potentially exposed. And then also, owner would not be required to notify the consumers if there were any issues such as contaminants in the first place. So let's say they did bother to take samples, they found these issues, and they don't want to have their consumers up in arms, so they could just choose not to notify the residents in the first place, and then who knows how long these residents or other people could be consuming this potentially contaminated water and getting sick, whether if it's not immediately, chronically consuming this water, it could be leading to diseases or cancers in the long run. I guess before I move on, I wanted to give a case study, I guess to see if there's any questions anyone has about what I just shared.
I don't see any questions in the chat so far, but I'll let you know if we get any.
Okay, great, thank you. Yeah, so all that information, general information is good and all. I think everyone will understand and comprehend it better if there's an actual example. So this is a very recent case study. It's actually active, ongoing enforcement, so I will not be speaking on how they are complying, but we'll be sharing some basic information that's publicly available. So Lebar Ranch is a mobile home park located on fee simple land within the exterior boundaries of the Pala Reservation. And the residents at this mobile home park, whom I believe are primarily non-tribal residents, have reported to Pala for many years that there were failing septic systems with raw sewage spilling onto the surface and causing odor problems throughout the community. And the owner was unresponsive to their complaints and not addressing their concerns. When Paula went out with their inspectors, they determined at the time that there were approximately 90 people living at the mobile home park, although later we learned that there was actually 75 people and that there were 17 service connections. So if we can recall our definition of a public water system, this meets the definition of a public water system since it's 25 people or more, and it has 15, more than 15 service connections. And this would also qualify as a community water system since it's serving a residential population that's living there year round. And so when Paula brought this mobile home park to our attention, we checked our records at EPA and we did not have anything about this water system. So it had gone unregistered with EPA and unidentified as an actual public water system for a number of years. I wanted to share a map so you can have a better idea of what we're working with here. So the area highlighted in red is Lebar Ranch. Not humongous, as you can see, though it's completely surrounded by trust land. And not only that, tribal homes are located immediately adjacent to this mobile home park in the community. So when there were these events where there was failing septic systems and untreated sewage at the surface causing odor problems, it easily could go over and affect not only the residents, which was unfortunate, but also affect the nearby tribal community who was living nearby. And there was also concern since Lebar Ranch relies on a drinking water well, which is located roughly in the upper right-hand corner of the property, that this waste could be contaminating the drinking water, which would contaminate the drinking water well, not only for Lebar Ranch, but also could potentially contaminate the aquifer, which the tribal members nearby would rely upon. Sort of just summarize some of the concerns. I discussed some of them already. The failing septic systems, there are approximately 10 septic systems on site that were potentially failing. But on top of that, the drinking water system was unmaintained and no one really knew what the status of it was. We didn't know if there was treatment. You couldn't tell. The well was unprotected and the distribution system was unmaintained. The PADA inspectors who went on site observed broken water lines, which are a concern because that could lead to potentially contaminants directly entering into the finished drinking water and directly causing illness to the community. And one of the major issues was just the general lack of information. We didn't have much data on the drinking water or the infrastructure and an exact status on the septic systems. And so that lack of information was concerning since, we couldn't be sure that the water that was being served was safe to the community. I also wanted to note that this was during the whole COVID-19 crisis, which is still going on. And we relied on Pala tribes inspections and their assessments and evidence gathered rather than EPA going out to do an inspection, which we traditionally would have done. But luckily, Pala was able to go out, at least during the beginning of the crisis, and collect some of these observations so that EPA would be able to try to follow up to the best of its ability. Everyone loves some photos. So this upper photo here is one of the septic systems. And as you can see, it is completely full. So it shows to the need to regularly, not only that it's failing, but needs to be regularly pumped. It's just inches away from flooding the nearby surface area. And then below is just another map of Lebar Ranch in the affected community. Here's a couple of photos of some septic system lines that are at surface level, which is not optimal. Generally, you want these buried right. That way, there's a lower chance that it can be, be exposed to damage and then, subsequent leak, which, would not be great. As seen in the picture on the right, if, since it is open to more exposure and damage, if there was some sort of leak, there was a kids play area immediately next to this septic system line, and they could be playing and then potentially getting sick if there was some sort of rupture in the septic system line. So what actions did EPA take at this mobile home park? So first, we issued a request for information. We wanted to give the owner a chance to try to provide us some context and maybe drinking water data, if he had that, to determine the extent of the issue. If any, maybe he's been collecting regular samples and can, vouch for the fact that there's, no contaminants, or he's been monitoring for total coliform and E. coli, and he has not had a hit, in the past. But we issued that, and no meaningful information was provided. There's no data, and we weren't even able to actually still determine what the infrastructure was for the well or the tank or anything. So in light of the lack of information and the concerns that that were gathered by PALA, EPA issued an emergency order, which required a number of items. First was a boil water advisory. Since EPA did not know the water quality, and it couldn't be trusted until there was samples taken, especially in light of the sewage potentially contaminating the drinking water well. We wanted to make sure that any residents who continue to drink the water boiled it before they used it. Also required a collection of drinking water samples for the full suite of contaminants that a wellhead should have. I believe it's over 90 different contaminants that the respondent was required to collect. Also required them to hire a qualified operator to help maintain the water system, and also hire third-party technical providers and experts to fully evaluate any potential risks and the infrastructure for the drinking water and the wastewater systems. This was especially important since EPA is not able to go out, and even if we're not able to make determinations for some things such as distribution lines and septic system tanks and going into the ground and seeing what's going on. So we really wanted to get a full picture on what was going on and what level of risk is being posed. And we wanted professionals to be handling this, especially since the owner did not have professional background in drinking water or wastewater. And anything that these contractors identified as potential corrective actions, the owners we're going to require them to take corrective action to ensure that the community is fully protected. And then lastly, we also just asked for some basic information on the drinking water infrastructure, since like I said, we did not know if they even had a treatment or anything about the well before going into this emergency order. Pictured on the left here is the well in question, the drinking water well. I won't go into a lot of detail, but I mean, even just looking at this, there's a number of concerns. It was completely unprotected, not fenced off. Anyone could come and monkey about with the well, which was a concern. There's no vent, there's no concrete pad. So even just looking at this picture that Paula collected for us, we knew there was a lot of concerns with the infrastructure and that we wanted to take action as soon as practicable. And then on the right-hand side, that's the storage tank that is serving the community. All right, I guess we wanted to pause, see if there's any questions on the case study before I finish off with my last couple slides.
There's a question from Carolyn Yee in the chat. Must mobile park residences conduct their own water sampling, or can they demand that the property owner provide the test results annually?
That's a good question. So if it's a mobile home park and it meets that definition of a public water system and is being regulated as one, then it would be upon the owner and operator to collect those drinking water samples for a number of different contaminants, as you can see in the slide here, for over 90 contaminants they're sampling for. And the results should be reported annually in something called a consumer confidence report. So I believe to answer your question, if it's a public water system, then yes, the owner should be collecting those samples and reporting the results to the community. Is there anything else, anything that I missed there, Greg, that you wanted to add?
No, I think that covers it. You've got another question here, if I could tee it up, from Lisa Over from Campo EPA, and that question is, what kind of response did you get from the party, I think the owner, and what was the time frame they were given to respond?
So unfortunately, I can't comment too much into that. As I mentioned earlier, it's an ongoing enforcement action. So I can't comment on, the level of compliance that the owner is currently, doing. But we are engaged with him and working with him on all of those items. And in terms of the timeline, we have a timeline set for when they need to do the assessment for everything. And then we don't have a set timeline for corrective action because we want the contractors to do a full evaluation and come back with us on what those fixes should be. And depending on the level of fixes, it would determine on how long it would take to make those fixes. So nothing fully defined, but since it's an emergency order, we're pushing them to, do this as quickly as possible.
And there was another question here, or rather a statement. Nick from RCAC was clarifying that, let's see, what was that clarification? Was it Nick? I believe it was a clarification of Carolyn's earlier question. And he said, as long as it has 25 full-time residents a year. So I think what he's indicating is, right, who has the responsibility to collect the water samples, the system owner or the residents. And again, so long as it's a regulated public water system, any of those that Chris discussed earlier, then it would be the system owner. So you're right, Jeff, as long as the system has 25 full-time residents, we consider that a community system, and the owner would be responsible for those routine compliance samples.
Yeah, correct. So if the mobile home park is small and there's only five homes on it and serving 10 people, then at least based off the information provided, it doesn't seem like it would be a regulated public water system, and then it might be a little bit murkier on who should be doing what.
Well, this was a good time for a pause because there are a number of questions, and Carolyn asked a clarifying question about the time frame, meaning what happens to the mobile park residents in the meantime for potable water use. I guess in the meantime between when we issued our order and when the improvements were made such that we're confident that the water is safe.
Right. So at least in the situation that I described, that's why we had them on a boil water notice. We want to make sure that they're aware that the water may not be safe to drink, and to consider alternative sources. Based off of my understanding from when speaking to the tribe, I believe a lot of them were already using alternate water sources, at least for drinking, anyways. And then we'll keep them on that notice until EPA feels comfortable that the water is safe to drink, and then we would remove that, and they could, if they feel comfortable with it, consider drinking the water coming out of their faucet.
Yeah, and Chris, I'll just clarify that the background to the issue, to our issuance of the boil water advisory, is that we were most concerned about potential microbial contamination to the well. So in boiling the water, the residents would kill, any bacteria that we'd be concerned about in the water. There are other contaminants for which, nitrate is an example that we would not recommend residents to boil the water, because you could actually concentrate that pollutant. Yeah, there was a lot of thought gone into the type of actions and the next steps to this order to be most protective of the residents.
Thanks. Anything else?
One more question. How soon from the time the emergency notice was offered or issued in this case was a reliable E. coli sample taken, if that has already taken place?
Yeah, so pretty much after we issued the order, coliform samples were taken, I think by the second business day. So they took it as soon as he was able to, second business day. So, and then we got the results by the end of the week. So we required the collection for the coliform samples as soon as possible, since that was the biggest concern. And then for the rest of the contaminants, they were required to collect those within 1 week.
Well, perfect, Chris. I think we have a pause in the question. So if you want to continue.
Great. All right, just a few more slides here. We already covered some of this, talking some basic requirements for public water systems, as I mentioned. It requires the routine monitoring for over 90 different contaminants. Of course, that doesn't cover known contaminants, but EPA does try to do its best to regulate for the most common contaminants, or the contaminants that have the greatest concern to public health. As someone asked earlier, there's an annual notification requirement to residents on the water quality status, a document called the Consumer Confidence Report. On top of that, if there was any sort of violation, such as exceeding a maximum contaminant level, there could be quarterly notification, or even earlier, if there was a E. coli hit, then there could be a notice within a couple of days after that has been detected. And then, as mentioned before, public water systems are required to be visited by regulatory agency. Generally in Indian country, that'd be EPA, typically every 3 to 5 years, depending on different factors, to help identify any deficiencies, to ensure that it's fully protective of public health. Okay, so I wanted to discuss maybe a few tips on trying to identify an unregulated public water system. It's may not be the easiest thing to do, or something you even think about. But if you're a resident, or someone who's a resident who had never received a consumer confidence report, so that annual report detailing the state of their drinking water, there's a chance that they could be being served by an unregulated public water system, or it's a water system who is just not submitting their report. And I guess that would also just be they be in violation of the Safe Drinking Water Act. If you try to think about it and say you did have some concerns about your drinking water quality, do you even have anyone who you could call to speak about it and have to come check out the drinking water complaint in the first place. And you can't even think of anyone really operating this water system in any sort of orderly fashion, then may not be regulated. Similar to that, if you're not paying rates to maintain, then that could also be a flag. There are situations where sometimes rates aren't required, but typically there's some sort of at least small fee to pay to maintain water service because it's not free for the maintenance and regular monitoring and paying for an operator and all of that. If you're living in a small remote community, which there's a number of those in Indian country, or you're working at a pretty isolated company facility, it might be something worth considering to yourself, maybe kind of trying to think about where is my water coming from? Am I being served water that's regulated? Because if not, and you think it should be regulated, that's something you might want to notify EPA about, because for all the reasons I mentioned earlier, I think there's a lot of benefits to having a regulated public drinking water system to protect yourself and your community from potentially contaminated water. And so they have a greater awareness if there were any issues. All right, and then if you did have any questions or concerns about, is this a public water system, or I want to check, am I served by a public water system? And we might be able to tell you, based off of your address or a description of the area, you can contact Emmanuel Repicavoli. Not sure if I said her last name right, so I apologize if that was incorrect. She is the manager for the Tribal Drinking Water Office, and she'd be more than happy to try to help you navigate and determine, whether you're being served by a public water system, and if so, helping provide you information, and if not, trying to work with you and or trying to figure out who the owner is to get that system registered with EPA and getting them on a monitoring schedule and everything else. Wanted to provide an example of a consumer confidence report. This is just a template that the state of California has. So typically you'd actually see the word consumer confidence in the report that you should be receiving, and you'll see terminology flying around in these reports, usually something like maximum contaminant level and drinking water standards. So if you haven't seen anything like this before, something to be concerned about, because either it means your water system is in violation or you're not being served by a registered drinking water system, or you're just in an area where, maybe it doesn't meet the definition. A couple signs of a private well, like I mentioned before, if there's a well, but then that water is just being pumped directly to the surface to a spout, and there's no piping leading to any homes. That'd be a private well and wouldn't meet the definition of a well that would be used for a public water system. And there's a lot, especially in rural areas, there's a lot of homes who have individual private wells, and typically those wells, they wouldn't have a storage tank since it's not needed, but you would have maybe a pressure tank on the outside of the house or in the basement. And so if you see that, and those may be signs that you're on a private well or someone else is on a private well, and it would not be regulated by EPA. And then lastly, just a couple of resources, provided a couple of links. I believe the slides are available on the website. On the left here, there's EPA database for consumer confidence reports. You can try to look up consumer confidence reports nationally. Although I want to know, I believe for tribal water systems. I'm not sure if all of them are up and it's working correctly right now, but you could still at least look up consumer confidence reports at any state. And then if you want to see the list of regulated contaminants by the Safe Drinking Water Act, I thought this site here, maintained by EPA, was particularly helpful because it not only had a list of all the contaminants, but also common sources for those contaminants and some of the health issues and risks that could arise from exposure to those contaminants. Anyways, that's my presentation. Thanks to everyone for attending today and listening. I have my contact information on the front page of the presentation, and I will open it up again for any last questions. Were there any other questions in the chat box?
I don't see any questions right now. I think Greg has been answering some of them.
Okay, great. And then if you do have any other questions afterwards, like I said, you can reach out to me or Greg, and then also on the slides, you can also feel free to reach out to Emmanuel, the manager for the Tribal Drinking Water Office, and we'd be more than happy to try to help you with any issues.
Yep, Chris. So one last question did come in. Carolyn asked to clarify, and that is there a good resource for searching to identify a public water system in Indian country? And I responded quickly that EPA's ECHO database is one source to identify if your system is regulated. Honestly, it's not the best source. However, prior to this conversation, Chris and I chatted about a very useful website, Drinking Water Watch, which is useful for identifying drinking water systems in state jurisdiction. So we chose not to highlight that because, again, there's a gap in Indian country, and instead to focus on our ECHO database. So we'll share that link. And of course, if you have any questions navigating ECHO, you could reach out to Chris or I or others to help you with that data.
Thanks, Greg. Yeah, I don't think I have any other resources besides what you mentioned off the top of my head, at least.
There's one more question from Lisa that asks, is SDWIS a source for getting information on tribal systems?
SDWA. I think you could pull some information on tribal water system from SDWA. I'm actually not sure what the public facing what SDWA is capable of. I'm not sure if Greg can elaborate on that more than I can.
Yeah, unfortunately, I'm not the best resource on that, but my understanding is that the database that we use here in Region 9 feeds federal SDWA, or Fed SDWA as we call it. So Fed SDWA is really a fantastic repository of drinking water information, but my information is that it's not as user-friendly as other databases to extract information from. That's why we have ECHO as kind of a layer, which has different search tools, which would draw data from SDWA. So again, I think the ECHO link would be how you would access that data.
Yeah, so if you're knowledgeable with SDWA and can navigate it, I think all that information on the drinking water quality is there, but there's a little bit of a learning curve to trying to navigate and decipher the database.
Thank you. And I see here Emmanuel posted the ECHO webpage, and I see Corolla, I hope I pronounced that properly, posted a website for California Water Boundary Tool, which is interesting. I haven't seen that. So there's a couple of good resources posted in the chat box.
Yeah, that's great. Thank you. Okay. Well, like I said, any other questions, feel free to just reach out to us directly. Thanks again to everyone for attending. Hopefully it was at least somewhat helpful. All right.
Thank you.
All right. Signing out.
Good job, Chris.
All right.